Well, good morning, everyone. I want to start by thanking you, the people of Ontario, for the patience and understanding you've shown as the province proof of vaccination system is rolled out. We ask that everyone continue to demonstrate the same cooperation and understanding that has gotten us this far, and to focus on what these temporary measures mean to us. They mean we can allow businesses the comfort to keep operating safely. They mean we can continue getting back to doing things we want without losing the gains we've made. And they mean we have the best chance to avoid being forced back into lockdowns that nobody wants. Much like the vaccine rollout, we asked Ontarians to pull together, and you've responded once again. And for that, I thank all of you. Starting today, individuals born in January, February, March, and April can log on to Ontario's vaccine portal to download their enhanced certificate, which now includes their official QR code. Tomorrow, individuals born in the months of May to August can do so, followed by anyone born in the months of September to December on October 17th. We cohorted the downloads to help ensure a smooth and seamless experience, while ensuring that everyone can be ready well before the new enhanced certificate takes effect on October 22nd. As of 6 a.m. on October 18th, any individual, regardless of your birth date, will be able to log on and download. Also, as of today, businesses and organizations can download and verify Ontario app to scan and verify customers' QR codes. This will give businesses an opportunity to test and get used to the app, well ahead of October 22nd implementation of the enhanced certificate. Together, the enhanced certificate and Verify Ontario app will make it easier and more secure for Ontarians to show their proof of vaccine. As we've developed these tools, protecting your privacy has been top of mind. Minister Elliott and Rashid will go into more details, but I want to thank everyone involved in standing these up in a record time, and thank you to everyone. They play a very significant role in our continued fight with COVID-19, and we continue to do well in this battle. We're doing well because our approach was cautious and built on the advice of our public health experts. We've seen what happens in other provinces that move too quickly, and the result can be devastating. Here in Ontario, hospitalizations and ICU admissions remain stable as our daily case counts have declined, even weeks after we began in-class learning. Because of this success, because so many of you have rolled up your sleeves, we're now able to finalize our plans to exit Step 3 of the roadmap to reopen and cautiously lift more public health measures. The work began months ago, and we're finalizing the plan now, including where and when we may need to reapply measures should they be required to stop a surge in transmission. The Chief Medical Officer of Health has been clear. The objective is to avoid further lockdowns. And if additional measures are necessary, they will be localized, tailored, and aimed at limiting disruption to businesses and families. Because this is not just a plan for the short term, but for the long term as well. It's a plan that will stand the test of time. We want to give Ontarians more certainty and a better idea what to expect in months ahead, including updated travel guidance as we approach the holidays. As we do, we will remain vigilant in our fight against COVID-19. We will continue to do what's necessary to protect our communities and our hospitals. Over the past several days, both here in Ontario and elsewhere across Canada, the issue of how to best protect our hospitals has once again come up. As we've seen Quebec delay the implementation of their vaccine mandate for hospital workers, with BC softening theirs. Here in Ontario, many hospitals have implemented mandatory vaccine policies, as our government has maintained flexibility for health leaders to do so if appropriate. While some have called for province-wide mandate, any decision to do so needs to be weighed against the real risk of staff shortages that could compromise care. According to recent estimates, 15% of our health system workforce remains unvaccinated, putting the magnitude of potential staff losses in the tens of thousands. Let me be clear, every hospital worker should be vaccinated, and we encourage all of them to get vaccinated, and the vast majority have. But at a time when our doctors and nurses are already stretched to their limits, especially in northern and rural areas, we can't afford to lose qualified staff. At the same time, outbreaks in hospitals remain a rare occurrence. Thanks to the comprehensive infection prevention and control measures, in the past 2 weeks, there's been 2 outbreaks in hospitals involving a handful of cases. That's good news, and we can call a welcome news. But all told, this is a very complex issue with real risks on either side, risks that need to be weighed against the unintended consequences they may force. Recognizing the complexity of this issue, I've asked our top experts in the province for their feedback. This is an issue we need to get right, and we will, because together there's no challenge we can't overcome. Thank you, and God bless the people of Ontario. I'll hand it over to Minister Elliott.
Thank you, Premier, and good morning, everyone. Every day, thousands more Ontarians are rolling up their sleeves to help stop the spread of COVID-19. Our vaccination rates continue to climb, and since proof of vaccination came into effect, we've hit the amazing milestones of more than 87% of eligible Ontarians having received a first dose and more than 82% receiving both doses of the COVID-19 vaccine. This is a remarkable achievement, and we are grateful to everyone who not only received the vaccine, but to all our healthcare workers and local partners that have been instrumental in ensuring that people in every corner of our province have easy and convenient access to vaccines. Thanks to these efforts, our public health and healthcare indicators are continuing to trend in the right direction. Proof of vaccination has added a further layer of protection, helping to keep businesses open, protecting individuals in higher risk settings, and further increasing vaccination rates. Today, we are making it easier, faster, and more convenient for Ontarians to show their proof of vaccination, allowing them to safely access businesses and other settings across the province. The enhanced vaccine certificate with official QR code will be available for download through the COVID-19 vaccination portal over 3 days, based on birth month, starting today for individuals born between January and April. And as of October 18th, at 6:00 a.m., the portal will be open for everyone to download their vaccine certificate. Individuals can also call the Provincial Vaccine Contact Centre at 1-833-943-3900 to have their enhanced vaccine certificate emailed or mailed to them. The enhanced vaccine certificate can be printed or stored on your phone, and the QR code allows it to be quickly scanned by businesses using Ontario's free verification app, Verify Ontario. While individuals can continue to use their current vaccine receipt if they feel more comfortable doing that, we encourage everyone to download their vaccine certificate with QR code as an easier, more secure way to have your proof of vaccination verified. In doing so, we can help stop the spread of the virus, protect our hospital capacity, and keep our businesses open. And if you haven't yet received your vaccine, please do so today. Thank you, and I'd now like to turn it over to Minister Rashid.
Thank you, Premier Ford and Minister Elliott. Good morning, everyone. I'm here to explain what we have done to help safely and quickly verify the Ministry of Health's official QR code. The government has created an app called Verify Ontario that will allow businesses and venues to easily scan the vaccination status of their patrons and visitors. It is a technology that will protect our hard-fought progress and help avoid future lockdowns, and will do that while protecting people's privacy. Ontario businesses have suffered tremendous hardship throughout the pandemic, and I feel their pain. That is why we are doing everything possible to provide them with the stability they need and deserve. And I'm happy to say that businesses can now download the free Verify Ontario app from the Apple app and Google Play stores. The app and QR code is being made available in advance of the October 22nd deadline to ensure that businesses and Ontarians have sufficient time to download the app and QR code to become familiar with it. To design this app, we consulted with small, medium, and large businesses, restaurants, sports, and cultural institutions and venues of all sizes across all sectors and regions of Ontario. It can work offline without an internet connection, but like any app, it will need to connect to the internet periodically to keep it up to date. It includes a flashlight feature to make it easier to use in restaurants and bars at night. And we have published the code of the app online for free so that other jurisdictions can use it too if they want to. This is how it will work. When someone enters an establishment that needs to check vaccination status, they will show their QR code to the person checking at the door along with a piece of government-issued ID. Their QR code will be scanned by the Verify Ontario app, and in seconds, the app provides the result. A green check mark if you meet the eligibility requirements, a yellow warning if the QR code is not valid, and a red X if the individual does not meet the vaccination criteria. I want you to know that the Ministry of Health's official QR code has been created using the Smart Health Card format endorsed by the Public Health Agency of Canada. The Ontario government's enhanced vaccine certificate with an official QR code is the only trusted and legitimate option. This format provides a privacy-protecting standard and aligns with what other jurisdictions are doing. Ontarians can also take comfort knowing that Verify Ontario never stores any personal information, and the app only shows the minimum amount of information necessary to confirm vaccination against government-issued ID. Your health information is private and safe. But digital first doesn't mean digital only. To be clear, paper certificates will still be valid, but our government is giving Ontarians a more convenient option. To do that, we are giving the people of Ontario a choice to either download official QR code or continue with the paper certificate. And we are working to ensure Verify Ontario can read the Smart Health QR codes from other provinces such as Quebec, BC, and Yukon, which will support approximately 75% of the Canadian population. Learning from the work in Quebec, the Ontario Digital Service created the first prototype of the app to test the concept. MLSE offered the support of their world-class digital team to help accelerate our development. Our digital teams work together to write and test code. Pairing up with MLSE app engineers with Ontario Digital Service engineers helped Ontario deliver the app sooner. I want to personally thank my team at the Ontario Digital Service in the Associate Ministry of Digital Government and MLSE for making the Verify Ontario app possible in just 5 weeks. This is a great example of a successful public-private partnership. I also want to thank Ontario's Information and Privacy Commissioner for working with us to get this right and to ensure that the privacy of Ontarians is protected. Finally, I encourage all Ontarians to get an enhanced vaccine certificate with an official QR code and every business to download and use our Verify Ontario app. And last but not least, download, show, scan, and go. Thank you.
Morning, Premier. Natasha MacDonald, Radio Canada.
Hi, Natasha. How you
Hi,
doing?
I'm great, thanks.
Good.
You mentioned Quebec. Quebec this week delayed and essentially failed for now to implement mandatory vaccination in healthcare. 22,000 healthcare workers remain unvaccinated there, despite the threat of being suspended without pay. Are you concerned that imposing a similar measure in Ontario will yield similar results? And why did you wait until today to consult hospitals on that?
Well, first of all, Natasha, thank you. And I can see what's happening over in Quebec. I can see what's happening in BC slowing things down. And on one hand, I've been up here preaching. I'm going to continue to preach. I want every single healthcare worker to get vaccinated. The reality is we're seeing tens of thousands, 15%, that refuse to get vaccinated. It's very, very concerning. And I ask myself, you know, on one side, get vaccinated. On the other side, the docs and the nurses have been stretched to the limit. They are stressed out to the max. We're already short of approximately about 15% on the frontline healthcare workers, and we're going to add another 10 to 15% on top of that, which is 10,000 or more than 10,000, tens of thousands of frontline healthcare workers. I've sent out a letter to all the hospitals, and there's a big difference here. There's a difference between, and by the way, they're all great hospitals, great downtown hospitals, versus hospitals in Timmins that I visited, or in Sudbury or in North Bay that are in desperate need of frontline healthcare workers. What is this going to do to the system months down the road? What's it going to do when people go in there for cancer surgery, diagnostics? What is it going to do to our healthcare system as a whole? So those are the answers that I'm requesting that the CEOs send back to us, and it gives us a better idea. But again, I encourage everyone, please get a vaccine. But on the other hand, can they maintain the quality? Can they still continue with the COVID-19 processes that we've implemented? So there's a lot of questions, and I just want to make sure we get this right. I want to hear from the hospitals. I talk to CEOs every single day from around this province of hospitals, and I get different stories depending on where they are, if they're in a rural setting, suburban setting. So let's see what they come back with.
My follow-up is for my CBC colleague, Mike Crawley.
Yes.
He wanted to know about Highway 413
Yes.
because it's featured in your new TV ads.
Yes.
Why do you want to build this highway, given that it won't save drivers much time, and will you make it a toll highway?
Well, I'll respectfully disagree with Mike. It's going to save a tremendous amount of time. Folks, we're a growing province. We're one of the fastest growing jurisdictions in North America. We see the influx of people coming here, which I welcome. We need more people to fill the jobs. The highways are congested everywhere. It doesn't matter what 400 series highway you take, no matter if it's the 401, which is like a parking lot, or going the 403 and so on and so forth. We need more people to get from point A to point B in a much more faster fashion that they can spend time with their families. And we can transport goods from point A to point B. Building infrastructure, that's what we do. That's what I do as a premier. I build infrastructure, I build transit, I build bridges, hospitals, schools, and we're going to continue building. But as we're growing, and we're going to see a tremendous amount of people come to this province. Again, we're at 15 million. I'm guessing in 15 years we'll be closer to 19 million. We can't afford more backlogs on highways. But thank you for the question.
Hi, Premier.
Hi.
Laura Stone, Globe and Mail.
Hey, Laura, how you doing?
Good.
Good.
I'm hoping you can explain what happened last Friday when, late in the day, your government announced the limits lifting in huge stadiums, but not for restaurants, gyms, and bars. The small business community is very upset about this, and they feel undermined by your government. So can you explain what happened, and what do you say to those small businesses who have said that your government has continually undermined them throughout this pandemic?
Well, first of all, my heart breaks for the small businesses. I'm a business owner myself. I fully understand. And we've been there to support them, by the way. We've given small businesses to a tune of $4 billion in support. We're there for them. We need to support them. And I'll tell you what happened last Friday. We had a consensus. We had a consensus around the table and with the chief medical officer, and I'll be handing it over to the chief medical officer in a second, with the chief medical officer, the health table, in a sector that has very, very strong protocols. And we're going to get to the restaurants. We're going to be rolling out a comprehensive plan, one that will withstand the test of time. And I'm not going to rush it, because anything you do in this pandemic, you rush it, it can come back and backfire on you. But we have a comprehensive plan that we're going out next week. And again, we had consensus. We wanted to move on it. And I'll pass the rest of the details over to Dr. Moore, which, by the way, before I pass it over to Dr. Moore, I have 100% confidence in Dr. Moore, how he's led us through this pandemic, and I'm going to continue to follow the advice of the Chief Medical Officer.
Thank you, Premier. We have consulted with small business, as the Premier had said. We've consulted with all of our major partners and our scientific advisors, besides those in public health, and made a decision of what could open first. We're preparing a consolidated plan for this government to review next week, and I would ask that our business partners stay tuned. We'll provide dates and timelines and data by which we anticipate further opening of the economy in a staged, phased, and cautious approach that will best protect Ontarians and our businesses and allow us to step forward and not step backwards.
Thank you. And just back to the healthcare workers, I'm struck by by your remarks saying 15% of the workforce remains unvaccinated, tens of thousands of workers. Your letter seems to be cataloging reasons why you feel that you cannot impose mandatory vaccines. Is this a foregone conclusion that it's going to be too difficult and you're too concerned with losing that many workers?
Not at all. I've always given the flexibility to the CEOs of the hospitals to make that choice. My point is, it's easy to go out there and say, fire everyone. That's an easy solution. People have to look at the ramifications down the road. Where are we going to be in 2 or 3 months when they're short tens of thousands of people? Nurses and docs are stretched and maxed out to the limit right now. And all I'm saying is, what are the ramifications in your hospital? We sent it out to every single CEO of every single hospital. And of course, Ontario is a massive area. It's different in the far north compared to southwestern Ontario and out east and downtown Toronto. But everyone has their challenges. And I can tell you one challenge, we're short healthcare workers. We're training as many as we can at record numbers. We're trying to get them back into the system as quickly as possible. But I go back to, how's this going to affect your backlog surgery? How's it going to affect the diagnosis? How are you going to affect when you go in for an MRI scan or a breast cancer scan? Is it going to continue to be delayed? What is their plan? Each hospital, I need to hear from them to find out what plan they have to make sure this doesn't happen.
Hi, Premier. It's Richard Southern with City News 680.
Hi, Richard.
How you doing? Despite the fact that you said you had consensus, a lot of restaurant owners are very upset and very confused about how that went down last Friday and why the Leafs could have 19,000 fans packed in. Creating further questions was what we reported last night, that MLSE partnered with the province to get this app up and running. Sir, did MLSE get any preferential treatment here?
I'll tell you right now, absolutely not. That's a 100%. It's not just about MLC, by the way. It's about the CFL. It's about the small towns around Ontario that have small OHL teams, be it, Sault Ste. Marie or London. It was a whole encompassing area. But most importantly, we had the consensus with the Chief Medical Officer of Health. The protocols are second to none within MLC, and they're doing an incredible job. But we have a plan, a very strong plan, by the way, moving forward, a cautious plan, that we're going to support the restaurants. We will get the restaurants open, but we're going to do it cautiously. We're going to roll out our plan next week, and that's really the answer. We've been in full communications. Personally, myself, Let's talk to Todd over at Restaurants Canada and other stakeholders. I've talked to dozens and dozens of restaurant owners, and I told them, you know something, my heart breaks for them, but I'm going to do this right. There's no way I'm going to rush this, and all of a sudden, in 4 weeks, we see numbers go up, and we have to go backwards. We have the QR codes coming out, and by the way, Minister Rashid, you've done an incredible job, but not just Minister Rashid, the whole team that put this together ahead of time, and hopefully it's going to be seamless. And they've done an incredible job, and it's going to be much easier for businesses, including restaurants, to be scanning a QR code. And by the way, folks, if you don't have a QR code, if you have the certificate, that works too. It's not mandatory you have this QR code, as long as you show proof of certification. I know a lot of seniors have went into our MPP's offices to get it printed out, get it laminated, help them out, and I'm glad that we're able to help.
Premier, on another matter, motorists are paying right now the highest gas price they've ever paid here in Ontario. Carbon tax aside, more than 30 cents of every litre is provincial tax. You ran more than 3 years ago on a promise to lower the price of gas. Do you intend to do anything right now to make gas at least temporarily cheaper, Premier?
Well, absolutely. I was the only government and the only leader, as far as I can remember. If people remember, a little while ago, I lowered the gas tax by 4.3%. I promised 10 cents. We're going to commit to that promise. But I also stood here month after month warning people about the carbon tax, which is about 10 cents a litre approximately, that everything would be going up. I challenged it in court. I lost in court, unfortunately. I respect the court's decision, but I kept warning, this is just the beginning with the carbon tax. It's going to be compounded year after year after year. The carbon tax is the single worst tax on the backs of Canadians that's ever existed. It's driving up the cost of groceries, driving up the cost of getting from point A to point B to work, driving your kids to work. I have fought this day in and day out. I have got along so well with the federal government, and I'm going to continue getting along with the federal government, but there's one thing that we disagree on, and this is carbon tax, and I'll never waver from that. You know, I will match every single penny. Here's a challenge. Every single penny the federal government deducts off their tax, we will match that. So hopefully they can do it. We have to be competitive. We have to be competitive against places around the world. And we need to make sure that we have competitive gas prices and government not gouging the people, because it affects every single aspect of life here in Ontario and across the country.
Good morning, Mr. Premier.
Hi.
Nisheen Ziafati, Canadian Press.
Hi.
Now that there are vaccine mandates coming in for long-term care workers, Dr. Moore has said his next priorities are areas such as acute care, home care, and education. Would you consider further vaccine mandates for workers in those sectors, especially since the education minister has said the rate for teachers is 80%?
Yeah, so you know something, that's an area that I'll pass over to Dr. Moore, but I will sit down. I'm always open to discussing anything. Again, Dr. Moore has shown incredible leadership, and that's what we do. When we make decisions, it's not a one-off decision. It goes through numerous people, and Dr. Moore has an incredible team, along with the science table as well, that he speaks to, and the CEOs of the hospitals. I do the same thing. I consult with the CEOs and stakeholders out there, along with our cabinet and our caucus. But I'll pass this one over to Dr. Moore. Thank you.
Thank you, Premier. Yes, we've started the consultation process once again with our partners in the acute care sector. We're also going to be expanding the review of directives for public health agencies, so organizations operating under the Borders of Health. We've had further discussions with the Ontario Medical Association, the Ontario College of Family Physicians about having immunization policies for all primary care in Ontario. So the list of partners by which we're having immunization policies in place is expanding and will be put in place next week. This consultation process at present regarding the unintended consequences of any policy is an important piece to get done to further inform any move by this province to mandatory immunization policies. But I'm happy at present that we're actually expanding the immunization policy category to those other health sectors to have a broad base of support for immunization. And as a healthcare worker, I do think it is our personal obligations for every healthcare worker that has any contact with a patient to be immunized, period. And that is echoed by all the registrars of all the professional colleges of healthcare in Ontario. It's a common message. It's a duty for every healthcare worker to be immunized. For 48 hours before you could have symptoms, you could be carrying that virus and transmitting it within the work setting. We can all have the best infection prevention and control practices, but we see there are ongoing gaps and risks to our patients. And where mandates have been put in place, I think it's been quite appropriate, and it's been based on risk, especially our cancer centers, those that are operating transplant centers, those that are taking care of vulnerable children. All of those have put mandates in place, which I think are absolutely appropriate, and they've done the right risks assessment for the right protection of their patients.
And you committed to your 10-cent promise for gas prices.
Yes.
Does that mean you'll still cut the provincial fuel tax, even if the federal government doesn't cut its tax?
I will commit to the promises. Promises made, promises kept. And we have a long list of promises made, promises kept. And I'll make sure that we put money back into the people's pocket instead of the government. Folks, I can tell you something. The worst place you can give your money is to the government. It doesn't matter if it's municipal, provincial, or federal. I'm a strong believer in a different theory. Put money back into people's pockets. They're going to be able to go out there and buy a refrigerator, do a renovation, go for dinner, so on and so forth. That's what stimulates the economy. The worst thing government can do is start pocketing the money of hardworking people, pocketing the money of hardworking small businesses. Let them put money back in their pockets into small businesses. They'll reinvest into technology, into their people, and they're going to grow their business. So I'm just a strong believer of the last thing you ever do is tax people. Hey, Rob.
Oh, hi, Premier. Rob Ferguson, Toronto Star. Question from Benzie and I. MPP Lindsay Park lied to you and her colleagues about getting or her intention to get vaccinated against COVID-19. Why is she still in your Progressive Conservative caucus?
Well, Lindsay, I had two MPPs that showed me a letter from a physician in good standings with the College of Physicians. I've accepted it. And I'm not, Rob, I'll be very frank, I'm not at liberty to talk about people's personal health records. And that's it.
The question here becomes, if you are confident in the proof, it contradicts what Dr. Moore said just about the general incidence of these valid exemptions, which should generally be no more than 5 per 100,000 people in the population. And you have 2 out of 70 caucus members with exemptions. Do you not find that odd, and do you not want Human Resources to look into this further?
I'm not going to have Human Resources dig into someone's personal health file, as I wouldn't in Toronto Star wouldn't want to dig into your personal health records because they're private. I saw the letters, and they were signed by a physician in good standings with the College of Physicians. And again, I'm not going to discuss private health matters, and that's it. I'm accepting it.
Good afternoon, Premier.
Hi.
Matthew Bingley from Global News.
Hi, Matthew.
I just want to ask about medical exemptions with this new product that you're putting out today. The QR code doesn't factor in medical exemptions yet. In Quebec, a province that had far less time to develop it than yours, you can get that QR code there. Why is it left out, and what's the holdup on that?
Well, this is a great question for our QR expert, Minister Rashid.
Thank you very much for the question. So the way the technology is developed right now, the QR code is connected to our health COVAX system. And once the COVAX system has all the necessary information, the QR code will be updated automatically. And then accordingly, individuals can download those QR codes respectively.
This will be our last question.
Okay, I'm not sure if I quite got the answer there, but for the second question, just on the paper version, we're allowed to go back and use the one that we had originally. Somebody could print off this version, and I'll ask anybody who's willing to really answer this one. Why not just say with this new QR code, you have to print off the new one, and it's more secure, it gives the option for both, and it's still, I'm just wondering why there is still the insistence on using the old receipt.
So again, we are giving individuals the choice, and I'm going to let Minister Elliott talk about the exemption part. But again, the QR code is connected to the COVAX system. And again, if individuals who are going to be exempt, once their information is uploaded, they just have to simply go and download the QR code, again, just so that the information is updated. But again, I'll just ask Minister Elliott to address the exemption part.
Well, the issue really is here is that we can only put information into the QR code that's already in the COVAX system, and the medical exemptions aren't in the COVAX system yet. So there will be a process that we will be going through where people who do have a medical exemption will then take it to their public health unit. It will be reviewed there and then will be input into the COVAX system through the public health unit, and then it can then be put onto the QR code. So we need to go through that process first, and then the QR codes will contain the relevant information. That's going to take a little bit of time. We don't have an exact date for that, but it's going to be up to the individuals to take that information once they get their medical exemption to their local public health unit.
And sorry, the paper receipt question as well? Why are we not going to the new one for everybody, just to print that off?
Well, we are going through that right now, but there will be a period of time where people can use both, because it's going to be, sometimes it might take a period of time. Someone might want to have their QR code mailed to them, for example. It will take 10 days by mail for them to receive it. In the meantime, they can still use the paper vaccination receipt that they have. So we have to accommodate the different ways in which people will be receiving the QR code.
Would that be phased out sooner or later?
Thank you.
Thanks, everyone.
Thank you very much.
Before we wrap up, folks, you know something, I always sit back and we've been very cautious and so on and so forth. Again, I just want to give a shout out to all Ontarians. The reason we're leading the world in vaccinations is because of you. It's because of our frontline healthcare workers and everyone showing the Ontario spirit, Team Ontario, and not just the people, but companies. And I usually, once in a while, I give out the shout out to companies. I want to give a shout out to the great initiative that's going to happen tomorrow on October 16th. And just to let everyone know, October 16th is World Food Day, and our food banks are doing an incredible job. I was down there last week meeting with everyone. So it's also the second annual Kraft Heinz Pantry Day initiative, and I want to thank Kraft Heinz for stepping up. If you buy a participating Kraft Heinz product tomorrow, that purchase will be matched by the company and donated to food banks across Canada, and helping to fight the food insecurity that we still have a major issue. Far too many Canadians are not being able to buy food, but companies like Kraft Heinz is doing an incredible job, so it's a great cause. I'm going to do it myself, and I hope you will too. And other companies, I want to give you a shout out. Please follow in the steps, and I know a lot of you are helping out, so if you're a food company or if you're one of the big retailers, and I know you do this, but we need it more than ever. So thank you to Kraft Heinz. Thank you to all the other companies that have helped out throughout this pandemic. You're all absolute champions. And again, folks, have a very safe weekend. Ontario is doing great. We're leading the world in vaccinations. We have the lowest counts anywhere in North America per 100,000, all because of each and every one of you. Thank you, and God bless. Have a great weekend, everyone.